Oh, okay. Okay, very good. All right, we will try this again. And where I was recognizing Ms. Manson and her legion of nurses and across the state. Ms. Manson and the association is working on a nursing initiative through the state legislature and is clearly working to help our nurse shortage in the state, the need for academic programs and incentives for individuals to become nurses. We also welcome Karen Haskell, president of the Healing Place, to our board, who was recently appointed by the mayor to serve on our board, and she is joining the Behavioral Health Committee led by Dr. Zippel. And I think we're all going to recognize this morning that this country seems to be moving along in terms of recovery with lower hospitalizations and case rates and relaxing certain of the COVID-19 requirements. Clearly, we encourage people to protect themselves in close indoor places where necessary, especially with people at maximum risk. As previously mentioned, I've had a lot of conversations with candidates for mayor with regard to placing a priority on public health. One of the key insights and takeaways from the last, well, almost, I guess we're beginning our third year with recovery from the pandemic, and those insights are driving future health initiatives, public health initiatives, and the need for resilience. Before we, let me make one other point. I would encourage you, as I have in the past, to have dialogue with the candidates for mayor. Each of you comes from a place that is very important, an important partner in public health, and placing a huge priority because leadership in public health emanates from the top. And we have a strong need for city leadership. So I would encourage you to become engaged, understand what the candidates' positions are. Before we begin the essence of our session, I'm asking each of you to mark your calendars. Given Jefferson County school systems and schools across the state clearly going into spring break in April, the April meeting right now as scheduled falls during that break, and the meeting has been rescheduled. There are 5 weeks in March, and so we will go on the 30th of March, same location, and that will mark the 4-week mark. So now moving to the business of the day, the first order of business is the approval of the February minutes. Are there comments? And if not, the chair will entertain a motion to approve the February minutes, which were included in your pre-read packet. Moved by Ms. Handmaker. Is there a second? Thank you. Is there any discussion? All in favor, raise your hands. Opposed? Abstentions? Minutes are approved from the February board meeting. This morning's perspective session focuses on childcare, one of the most critical public health issues the pandemic surfaced. We've asked 2 policy experts and members of their teams to provide their perspectives on priority childcare related issues and public policies that this board should be advocating in collaboration with other entities and organizations such that we are able to demonstrably meet the needs of impacted residents and youth. Born in Eastern Kentucky, Kentucky Metro Councilwoman Cassie Chambers Armstrong represents District 8, which includes parts of the Highlands. She is my rep. I feel very honored to have such a good advocate, enlightened advocate for policies, healthcare policies. She is an assistant professor of law at the University of Louisville and worked as an associate at Kaplan, Johnson, and Byrd. Councilwoman Armstrong holds a BA and Master's in Public Health from Yale and a Master's in Science in Public Management and Government from the London School of Economics. Adria Johnson is CEO of the Metro United Way, having formerly served as the organization's Chief Impact Officer. Saluted by her board as a strong visionary with a passion for the community and a solid record of transformation and innovation in the agency, she served as former commissioner of the State Department of Community-Based Services, Louisville Metro Government's Assistant Director for the Department of Housing and Family Services, and in positions with several large Louisville companies. With her today are Mandy Simpson, Metro United Way Chief Policy Officer, and Ashley Brandt, Director of Early Care and Education, who leads the work of the Ready for K Alliance. Councilwoman, we'll ask you to lead it off, Ms. Johnson, and then we will entertain questions following, and we look forward to working in partnership with your group. Councilwoman?
Yes, thank you all so much for having me this morning. Actually, Adria Johnson and Metro United Way has a presentation to sort of tee up some of the issues, and then I have a quick slide at the end. And so if it's okay, I'll go ahead and let Metro United Way set the stage, and then I'll sort of jump in at the end to talk about some of the specific policies that we're advocating for in Metro government. But very excited to be here today, and so glad that you all are recognizing that childcare is a public health issue and one of the biggest issues facing our families.
Thank you.
Thank you, Councilwoman Chambers Armstrong. We are going to divide and conquer, me and my team, and thank you to all of you Board of Health members for giving us time to talk about this today. It is an important issue. It's been greatly, the struggles have been compounded very much during the pandemic, and so it is top of mind for many in this community and an area of focus for United Way, and has been for some time. So I'm going to quickly just give you a few slides that kind of give some insight into what the childcare landscape has been. And then I'll pivot to Ashley, who will talk about our response as an organization, and then she'll pivot to Mandy, who will talk about our response from a policy lens. And so, you know, childcare in general has always been a sector that has struggled, as you can see in this slide, for, you know, almost a decade. It was mentioned in my brief bio that I served as commissioner for the state of Kentucky for the Department of Community-Based Services. One of the areas of responsibility that fall under that agency are the administration of the CCAP program. So when I stepped in to that role in 2012, the state was facing some pretty significant budgetary constraints that resulted in participation in CCAP being limited. And that had, you know, a ripple effect in which, you know, access to childcare was greatly compromised. Provider reimbursements were compromised, and you can see what that has done to our state's capacity to provide childcare since that time. And you can see the number of family childcare homes, so that is home-based childcare, and the significant decline that we've experienced as a state in that capacity. What has compounded that is, you know, we already had existing childcare deserts, again, compounded by, you know, some budgetary constraints that the first bullet alludes to. But within our own land development code, the inability for then home-based care to be, erected in residential settings has further eroded the capacity that this state has to care for its youngest. And Mandy, when we pivot into the policy space, we'll talk about some of our efforts in that space. And then finally on this bullet, Kentucky has a stars rating system where the higher the number of stars that you go, it's a 5-star rating system. That is indicative of your center being higher in quality. And every parent that has children that utilize childcare wants their children to be in a high quality setting. And what's important to note in this bullet is, for those centers that are not in the higher, rungs of the STARS system, that is primarily driven by limited resources. It really is a resource issue with the ability to move along that STARS spectrum and have your center be high quality. So what's happened during COVID? When you think about an already compromised system, we know that has been further compromised, and that Louisville proper has lost an additional 9% of its childcare providers since the pandemic hit our community. On top of the loss of providers, our childcare centers, as you'll see on this slide, have really had to flex in ways that have really strained their ability to stay operational. We all know how every business had to adapt. That is, childcare is not immune to that when positive cases were present. And so you can see the number of positive cases that have plagued our Louisville centers. You see a comment by one of our providers that is indicative of what many providers have expressed, and we have done quite a lot of surveying to stay close to the ground and to understand real time what was happening. But really, I think the dire nature of the inability to survive another hit is what you see in that comment, and that is real. And when you think about the inability to stay staffed, to stay open, we know that if we could have an additional 613 employees to staff childcare centers here locally, that would open up, more than 6,500 licensed spots for children. And of course, the ability to be properly staffed is largely prohibited by, what the childcare sector can bear in terms of the wage that they can provide those that are working in centers. To move along, just again to cite, how COVID has been impacted by the pandemic. A large percentage of Kentuckians cited childcare responsibilities as reasons for not working in 2021. You can see the sheer number of women that have left the workforce, which is incredibly troubling during the pandemic due to childcare issues and school closures. And you can see that as a state, our workforce participation rate has not been exactly what we would want that to be, and that has fallen even further due to the pandemic. So we're down to 51.4% in terms of workforce participation for women in the state of Kentucky. Just to kind of wrap it up before I pivot to Ashley, and to underscore the other slide that you just saw where we talk about the sheer number of women that have exited the workforce, the sheer number of women that are lacking and participating in workforce participation in general, further compounded by COVID. This is a sector that is heavily dominated by women. And so when you look at just the sheer number of directors and educators and staff that work within the childcare sector, you can see that 71% are minority or women directed and 51% are minority or women owned. So it really is eroding the ability for women to participate and work. And when we think about, just in some ways, it feels like we are regressing decades with the strides that we've made with women competing in the workforce. Again, just to give you a flavor for why it is such a struggle to staff these centers and to professionalize this work and to garner a deeper level of appreciation for the value that our childcare sector brings and the value that these workers bring. The median wage is $10.26, and that is better than it was when we first embarked upon really, leaning into the data and looking at where we were. We were at $9.78, so we have made some strides, but you can see that we have a ways to go. You can see again a comment by a provider that just, acknowledges the struggle to be able to pay decent wages and also stay operational. And then, of course, as we talked about the sheer number of COVID cases, you can see what that is for Louisville childcare staff that have themselves suffered 710 cases of COVID. And when you think about the sector that struggles with a viable business model, most of these childcare centers are not able to pay, and provide the level of benefits that we see in other sectors that further erode the ability to really attract and retain a strong workforce. So with that, I am going to pivot because this is an area that is near and dear to us. It is a priority for us as an organization. We know that a strong start in life is a deal breaker, or can be a deal breaker if you don't have that strong start, should I say. So, we've done much in this space way before the pandemic. So I would like for Ashley to talk about what we do as an organization, and then Mandy will lean in and talk about the larger systems level work that we're leaning into from a policy perspective.
Thanks, Adria, and thank you again to the Board of Health for having us here today to talk about this. I want to share this slide. Really is just an overview of Metro United Way's work in the early childhood space as a whole. I know we're talking about childcare today, but just want to highlight all of the work that we're doing in this space, and really the last point on there of 100 plus partners engaged in the work of the Ready for K Alliance. As was mentioned in the introduction, I lead the work of the Ready for K Alliance, and Metro United Way serves as the backbone for that coalition. And we are a coalition of over 100 partners, everybody who is working in that birth to 5 space. So Metro United Way, we prioritize early care and education, but we are not working in this space alone. We are not working in a silo, because really that would be impossible to do. There are so many great organizations and individuals in our community that are working in this space from prenatal all the way to kindergarten entry, and we are partnering with them, and we want to partner with those who are not yet engaged. So we know that unlike the K through 12 system, there is not sort of this single entity like the public school system that serves as the backbone for that time in a child's life and a family's life when they're raising a child during that time. So Ready for K is really trying to create that network and that system of organizations and direct service providers that can create a net for families, no matter what supports they may need, and ultimately ensuring that when a child enters kindergarten, they are ready to thrive. So all the other pieces on here are a work that Ready for K has been involved in. I'll also highlight our Ages and Stages Developmental Screening Hub. Metro United Way serves as the hub for our community, and we see that as a really strong tool to support families, especially in those early years, to ensure that their child is meeting those developmental milestones on time. So really, just so much is happening in this early childhood space, and very specifically in the childcare space. Mandy, you can go to the next slide. I'll share some of the things we've done since COVID. But one of the reasons we're so highly focused on childcare is because we know that children who show up to kindergarten on the first day, who have been in childcare before that first day, are the most ready to learn and ready to thrive. So not only, as Adria mentioned, is this a key workforce tool to bring women and families back into the workforce, but this is a tool for children as well to make sure that they are prepared, ready to learn when they start kindergarten. So since COVID, we have been very focused on supporting the childcare industry in our community. And we have done that mostly through advocacy for funding to support that network of providers. In Jefferson County, we have about 419 childcare providers, which sounds like a lot, but we have a very large community here. So that actually is not even meeting the need. And as Adria mentioned, is a 9% decrease from pre-COVID. So we've been really focusing on securing dollars to support centers through PPE, cleaning supplies, as well as direct payments to centers, just to help stabilize and make sure that they are able to stay open, keep their doors open. So we've done several rounds of that PPE and those sustainable payments. We are currently also have some funding from ARPA. thank you to Louisville Metro government for those funds that we are in the process right now of utilizing those funds to distribute yet another round of PPE, including COVID rapid tests in that distribution, the first time we are doing that, and are continuing to advocate for more funding as we go forward, because we know that this is an industry that really needs our support right now in order to stay open, in order to serve the number of children that they're able, and really to support the families and workforce in our community. So I will turn over to Mandy to share some of the work in the policy space that we're doing.
Thank you, Ashley, and great to be with you all. And just before I move off of this slide, I want to talk a little bit about how the funding deployment that we led strategically layered into other funds coming into the sector, because we know there were state dollars available to childcare as well. If you look at our previous deployment of funds, we were hitting areas that were gaps in where that funding was hitting and the ability to spend that funding was hitting. So when CARES deployment came from the state for childcare, it came in lump sum payments that providers indicated could cover roughly a week of their expenses. And they were facing closures far longer than that. So the direct payments that we sent to providers as stipends were for providers who faced a COVID-related closure. So if they had actually had to shut their doors and cease operationally, partially or fully, they were eligible for those first rounds of stipends, so that that one temporary closure wouldn't truly tip them into a permanent ceasing of operations. And then the PPE at that time was so interesting. You will remember it was incredibly hard to get in the early days of the pandemic. Even things like gloves. We had providers who were trying to run out to Costco every few hours during the day or every single night to try to get gloves and paper towels. What we were able to do is provide some centralized purchase power that could order these supplies in bulk and then deliver them individually to the centers as they needed them, and just make sure those supplies were in their hands every day. So that's kind of how the early COVID days looked for us. And then again, you'll see that we've strategically layered in the funds that we've been able to work with the city to deploy now. So if you remember us talking about that, on average, our median wage for childcare providers is $10.26 an hour. That cannot even remotely compete in this workforce, much less that it is far under what early childhood educators serving our youngest children and families should be making as the true trained professionals that they are. So wages are one of the things holding back, as you saw, our childcare capacity in this moment of intense strain. So the $600,000 that we'll be working to provide to providers are those who are not currently paying $10 an hour. Once they start paying $10 an hour, they will be eligible for an additional add-on to the stipends coming from the state. So we want to make sure that we are bringing in as much of those state dollars into our community as we possibly can, and that providers are doing the best they can to try to keep and retain the staff that they have and bring others into this space. But we have a lot of work to do here, which leads me into our next point, which is what we're doing right now in terms of our advocacy and policy work. I know Councilwoman Chambers Armstrong will talk more about this, but thanks to her dedicated leadership, the Metro Council will be on Thursday reviewing land development code improvements for childcare. We mentioned that back in 2011, childcare was pulled out of permitted use or even CPU use in residential zones, with the exception of family childcare homes who were currently defined just largely as in-home occupations, not even separately defined as family childcare homes, who serve fewer than 6 children. So as a result of that, the prior data would tell us we've lost the ability over the past decade to open more than 100 programs, and those are desperately needed spaces. So you'll see here just the bullet points around what would change if Metro Council does choose to pass these reforms. We very much hope that they do, and are continuing to speak with all members about how important these changes are. But it would allow family childcare homes the possibility of applying for a conditional use permit to serve up to the number of children that state licensing capacity would allow. That could be up to 12, but ultimately that will be determined by state licensing regulations, including actual per child square footage in indoor and outdoor space. It would also allow childcare centers in residential zones when they meet very specifically defined special standards as a permanent use or they receive a CUP. Neither of those options are on the table at all now. And again, we're talking about these R4 and R5 zones. We're talking about 60% of Jefferson County land where childcare in most cases is currently prohibited. And then it would also allow childcare programs when they can meet specific health and safety standards to open in industrial areas where parents work, which would open the opportunity of employers being able to partner to provide on-site or near off-site childcare for their employees. We also know we're grateful that our community is still working to ensure that we make the most targeted investments possible to lead to the greatest long-term outcomes of our remaining ARPA dollars. So there was an opportunity, and we were very grateful for it, to submit a request for information around early childhood initiatives this past winter, and the Ready for K Alliance did respond. We were grateful to help coordinate that response. So we've detailed across 26 pages the strategies we know can be most successful in impacting equity and opportunity across 2 generations, as early childhood strategies and opportunities do. A couple of the things that we highlighted and continue to talk with our city leaders about are localizing a program that would subsidize childcare worker wages and acknowledge again those educators as the true professionals that they are, and give our centers a shot at being able to operate even at their ideal capacity. Because right now we're seeing classroom, even if a childcare center is open, not all of their classrooms are, because they do not have the staff to fill them. So that is a problem we have to urgently address if we're going to address the barriers and access to childcare. We also know that the number one thing behind wages that childcare providers say is effective in retaining and recruiting staff is being able to provide childcare for childcare workers. And providers cannot just give this. Their business model will not work if they are in the whole enrollment, because they're working to provide childcare to their staff. So there are great models to follow for how we could do this to make sure that those who are working in childcare themselves have their children cared for at their centers or others. We also know that we've got investments to make. You saw our current quality environment, where we've got about 30% of providers who have achieved 3 stars or more on the quality rating system. And we know that that's about resources. I often say it's not magic, it's money, and it is just the cold hard truth of that reality. So investing in quality standards and of course built environments, land development codes will help provide more access to quality facilities. But right now we have to make sure that all of those spaces can have their needed repairs and updates that they can to be as safe and healthy for children as possible. And then of course we know not all children are in formal care settings. So there are several strategies the Ready for K Alliance supports to make sure that parents, as our child's first and best teachers, understand their child's development and can grow and learn with them and respond in healthy ways to their behaviors. And we know that those are needed in all homes as well. I also wanted to just quickly flag and shout out a big note of gratitude for collaborations that we have been able to carry forward with the Center for Health Equity that have allowed us to advance policy work. Last year in 2021, we partnered on a health impact assessment on the Child Care Assistance Program, which is the state subsidy program for childcare that we mentioned previously. At the time, we were advocating for an additional $12 million investment to increase those reimbursement rates paid to providers, which at the time were 40% of market rate as what providers who participated in CCAP received for the children that they served. And we successfully secured that $12 million in this past session. And we used this research and this data and this incredibly powerful report to help us do it. So we were really, really grateful again to link arms around that work in the advocacy and direct policy space. Also, hot off the presses, soon to be released, we're excited to share a qualitative research project that we did with birthing parents in our community, parents who have had children within the past 3 years, but we know face systemic barriers to positive experiences in that space. We focus particularly on Black mothers who do not speak English as their first language, and mothers who have faced substance use disorder, and really pulled from their narratives the policy directions that we need to head and the recommendations that we can bring forward and further support existing policy proposals on the table. So we'll be excited for, we know that Center for Health Equity will be sharing that out soon, and we'll be planning engagement around it as well. So I wanted to take a moment to say that. And with that, I will turn it over to our fearless leader and Councilwoman Chambers Armstrong.
Thank you so much, Mandy and Adria. And Madam Chair, could you tell us how we're doing on time? I know you all have other things on your agenda. I'm sorry?
We're getting low on time, but it's important to hear the advocacy and the work that you do because this is a priority area.
Absolutely. So I will go ahead and it doesn't look like I have ability to share my screen. So out of an abundance of making sure that we're sort of moving forward, I'll just go ahead and talk. I do have a slide. I'll send it to you all later. But what is Metro Council doing about the childcare crisis? And there are a few things that I want to flag for you. Some of them are urgent and involve votes that are happening tomorrow. So the first thing that's happening is something Mandy spoke about, which is changes to the Land Development Code to incentivize, encourage, allow more childcare providers. We've been talking a lot in the debate about family childcare homes, homes in residential zones. Right now, you can have 6 children as a matter of right. We would like to be able for people to ask for permission to raise that number through a process called the conditional use permit process, where neighbors get notice, neighbors can participate in the process, but also everyone can sort of come together and make a decision about whether this is something that a neighborhood could support. So that vote is happening tomorrow. Again, most of the conversation is focused on the family childcare homes. However, there's a lot of other great stuff in the bill that allows for childcare centers to be in all other types of zones that would allow us to, if an employer wants to offer on-site childcare, they'll be able to do that. That's really important because the state is actually offering incentives to employers who would open childcare centers on site. And as a mom of 2 little ones myself, think how great that would be for workers to be able to just have their children with them at work, for nursing mothers to be able to spend their break time nursing their child on site because their childcare center is right there. So this is a really great thing. If this passes, Metro government then has a responsibility to put some money into making sure that these changes are successful. And so that looks like providing coaches for our family childcare homes, providing business supports so that people who might be parents themselves and want to provide in-home childcare as a small business opportunity know how to do that and have the wraparound services to be able to be successful on that. Making sure we set up a landscape that provides things like subs, coaches, information so that people can be successful in taking on a new challenge and helping to provide care for children in our community. The other piece, which is more of a medium-term thing, is, as Mandy also mentioned, making sure that we spend our remaining American Rescue Plan dollars on strategies to support the childcare sector. So that can be everything from increased access to developmental screens. We're beginning to see data about the way that the pandemic has impacted young children, not COVID itself, not masking, not any of that stuff, but just changes to the way that children play and interact with each other, changes to the way that they have interacted with their peers. Many children have had less interaction with their peers. So we're seeing in early research some delays in multiple sectors, from gross motor skills, fine motor skills, social and emotional skills. And so how do we develop a strategy to be able to identify and address some of those developmental delays coming out of COVID, particularly for our most vulnerable kids and our kids who are from families that might not have had a lot of resources prior to the pandemic. We also need to be looking at improving the facilities of our child care centers, making sure that kids have access to outdoor play spaces, to any sort of infrastructure needs that our centers have. That's something that I think there's a lot of support for on council, is spending our federal stimulus dollars in these one-time investments to improve our childcare sector. I will say, Metro government, this is not something that we can do alone. This is going to take all levels of government working together to really make an impact. I do think that it is something that Metro government needs to have a role in, and historically we have said well, that's a state, that's a federal issue. It is a local government issue. It's a Louisville issue. It's a community issue. And it's something that impacts our community in such an important way that we as a city government have to take ownership over that. And getting city government into the business of being in childcare is really important. And so another thing I think is important is that we have a space in local government, something like a director of early learning, to be able to look at the childcare sector, understand what that sector looks like and what its challenges are, and make sure that that is institutionalized in government. And so that government is always thinking of this sector, has information about the sector, and is keeping the lines of communication open. We have an Office for Youth Development that provides youth with resources they need. It's a really important office, but it doesn't start providing services until kids hit the age of 16. And to me, that always has seemed a little backwards, that we don't start investing in our youth when they are young, when they're in this early learning space. The last thing I will briefly mention is, as we think about early learning and childcare, I like to use the phrase early learning. I think childcare makes people think of babysitting, and I want to try to think of this as on the spectrum of our education as something that is promoting the success of our youngest learners, of our children, setting them up for lifelong success. We have to take a holistic look. And so exploring things like, how do we deal with lead abatement in our city? How do we begin to think about investing in those types of changes that we know are so important? My office is going to be funding a family housing instability study that's going to kick off this summer. So we know that we have a crisis of housing in our city. We see a lot of that with unhoused people who are sleeping on the streets. What we don't see is the unique ways that families experience housing instability, which often looks like kids split up from their primary caregiver, sleeping on couches, going to an aunt's house, sleeping in a car. It's less visible and we know less about it. And so my office is going to be funding a study to collect data about family housing instability, what we know about it, and looking at some strategies our city could invest in to address that. Because of course, if families don't have a safe place to sleep, if children don't have a safe place to be, that's going to impact their ability to learn and to reach all kinds of milestones and to thrive overall. So with that, I will stop talking. I have more. I'll send you my slide later, but I would love to hear any questions that you all have.
Okay, so thank you. This board is a board that likes to get stuff done. Believing that should speak louder than words. And so most interested council your prognostics has it actionable barrier pressures.
I'm sorry, I'm having trouble hearing you. Was anyone else able to catch the question? It looks like Dr. Moyer might be coming up to the screen.
Yeah, I'm gonna switch it back to the phone. The problem is we can't hear you if it's on the phone, or you can't hear us. It's one way or the other.
Hang on.
Heidi, repeat.
Okay, sorry, Councilwoman and the rest. This board believes in actions speak louder than words. And so I'm looking for demonstrable actions, which clearly you are heading with regard to this particular issue. So it comes in, what can this board specifically do with people who can barrier bust? That would be the council, state legislatures. This is not a career, so to speak. What can we do to make a difference? And then have you had that discussion with the key mayoral candidates, both sides of the aisle, so to speak? Or street or whatever.
I can answer the last one first. Yes, I've been speaking to all the mayoral candidates about the importance of early learning and about why city government needs to be in the business of it. It is something that, because we haven't done it before, we as a government keep saying, well, we don't do that. And it's time for that to change. And it needs to be something that the city takes ownership over. In terms of action items, anything you all are empowered to do as a board to support the childcare zoning changes, whether that is a, sort of symbolic vote expressing your support, whether that is a letter, I know that that would be wonderful. Anything that you could do to express your support for if those changes do pass, for funding them, for saying, great, now we have these changes. Now we need to be putting dollars into actually building out a family childcare home ecosystem, into building out a childcare ecosystem. Also, if you haven't contacted your council person about tomorrow's vote on zoning changes, please do that. Please send a personal note and let them know that you support these changes and why they're important. The second thing would be anything you could do to express support for putting American Rescue Plan dollars into childcare solutions. Again, whether that's some sort of resolution, vote, show of support, or a letter saying, we think that this is really important. We hope that whenever Metro Council is considering voting on these, on the next round of funding, that it will include investments in childcare and early learning. I will have some more action items for you as things progress. I am beginning drafting a lead abatement ordinance. And so I would hope that I would be able to bring that to you all and have your support and your feedback and your partnership in that. And same thing, once we have this data from this family housing instability study, I would love to work with you all on what we could do to, again, sort of put dollars and solutions behind that.
Let me, and can you hear me? Okay.
Yes.
Let me just state this. The board does issue statements, and I'll ask Dr. Moyer and Amanda to secure the right verbiage for support. I'm looking around. I think that you've got people who are on the screen who serve vulnerable populations. I think we have a quorum here, and we'll be supporting it, but that's how we do it. We just have it in support of it. And I would encourage the both of you, if there are legislative issues that you want the board support on, if you will get the policy statement that you want us to consider for supporting, we can do that, and then we will distribute it appropriately. That's what we've done in the past. Does that sound okay to everybody?
That sounds wonderful. Thank you. And I will absolutely send over ordinances of interest as they arise, and really appreciate the work you all do. And I'm looking forward to a more robust partnership in the future.
Great. Now I'm going to open it to the board. Board questions.
Good morning. I have a question. I am a pediatrician with Norton Healthcare, and we have seen the impact of the pandemic in our children, especially the families of children with complex medical conditions and special needs. Is there any plan to allocate funding to train child care providers on the care of those children with special needs, specifically to children with autistic spectrum disorder and complex medical conditions?
Thank you for the question. This is a need that I just became aware of last week when I toured the George Unseld Center, and I was asking because, of course, they provide public preschool to 3-year-olds with a disability or 4-year-olds who come from either a low-income household or have a disability. And I was asking what has been the care background of the 3-year-olds with disabilities that you see? Where have they been? And they said, most of them have been at home because there is nowhere for them to go. There's sort of one center that can provide care, but even they don't necessarily have access to all the right people coming in to be able to meet their needs. And so I just became aware of what a challenge it can be for parents of very young children with disabilities. And so the answer is currently there is nothing specific, but I'm aware of the issue, and I would love to work with you all to figure out what we could do as a city to support these families and these children, because from what I am hearing, it sounds like it is a very unmet need in our community.
Thank you.
If I can jump in as well on that, we know that the state is also using their ARP dollars to specifically provide training for childcare providers. We know that there are very few childcare providers, private childcare providers outside of what Cassie is talking about for public pre-K that do offer services for children with special needs, and that is a need in our community. We are very fortunate that Dr. Sarah Vanover, who heads the Division of Childcare at the state level, has identified this as a concern of hers and something that she does want to address. So she has allocated some state dollars to do that. I'll also flag that Kentucky Youth Advocates, they have an initiative called Next Steps, which is also looking at the policy side of how to support those families. So there are some pieces that are being done, but agree there is not enough yet. So really still a lot of conversations and hopefully progress in that space.
Dr. Zippel?
So question, I completely agree with both the economic value of this as well as the value for kids today and on a long-term basis. But I'm curious if you have estimates of the impact of increased wages on recruitment and turnover. So if wages went up $1 an hour, what's the impact? If it was $2 an hour, what's the impact?
That's a great question, and one we're very eager to dig into as well. So the state stipends are now set up that you receive an additional add-on depending on where you are in your total salary range. So the state just began collecting that data for the first time in January. And I think within 6 months, we'll have a good indication of whether or not centers who are paying $13 an hour or more, where they are in their ability to recruit and retain educators compared to centers who are paying $10 or less an hour. And it's the first time we'll really have local on the ground data around it. We do know, though, from the experience of the landscape prior to the pandemic and during, that centers that were able to pay $15 plus an hour and really importantly, able to provide benefits like health insurance, held on to a larger percentage of their staff and were able to operate closer to full capacity throughout the pandemic.
Yeah, no, I mean, I think that's true. More is always better, but there's probably some tipping point with it. You know, at least in the behavioral health world, there are lots of experiences where an incremental increase has cost more, but hasn't actually moved the needle. You need to get to a certain point to do it. And I'm wondering if either based on local data or experience in other markets, you have an idea what the tipping point might be for that.
I don't think we know exactly what the tipping point would be, but I am hopeful that the data that we're getting, and Metro United Way has been a great partner in terms of gathering this data, will give us more information to move forward with some of these policy solutions and support them and support their efficacy. I will just say I have seen some data, particularly as it relates to very young children, the impact of caregiver turnover. Remember, for very young kids, they're spending a lot of their waking hours being cared for in a center, and whenever they have turnover, it can set back their development and their attachment with their caregivers during the workday. And so there is some evidence that supports how important, particularly for very young children, stability in a caregiver in a childcare setting can be.
Good morning.
One thing I'll share also related to the wages is the program that Mandy mentioned that we're advocating for with ARP dollar, which is called Wages with the S with a dollar sign. They have shown that in other communities where that program has been implemented, that payments, a 6-month stipend as low as $1,100 has improved retention. So it doesn't, while we want all of our early childhood educators to be having a decent and living wage, the funding needed for that is actually not too high. If we could provide, you know, a yearly stipend of $2,200, it's not a huge amount, honestly. So I think that there is some national initiatives that have been implemented elsewhere that we can learn from and work to implement here, and that is part of our advocacy for potentially using some local ARP dollars to do that.
And I just want to flag,
Dr. Miller?
I have to go and teach a class at 9, and so I'm going to hop off. I appreciate your all's time, and I know Metro United Way has lots of information to provide. So thank you again for letting me join you this morning.
And thank you for forwarding the materials. We appreciate that. Go forth and conquer. Dr. Miller, I think you had a question.
Yeah, just kind of a comment. I am I am a maternal fetal medicine doc at U of L, and I am very much looking forward to reading the data that you did about your pregnancy study, particularly in vulnerable populations. And I would ask that we think of everything we've talked about today from kind of a pregnancy to childcare kind of framework and not separate these things. I've noted that a lot of my moms, especially my young moms that are pregnant for the first time, have never thought about childcare. And if you've never thought about that process, and if you've never even planned for how expensive and what a barrier this is, you are already behind the 8 ball. And this really should be a part of prenatal care or well women's care, but it is not. And I think when this data comes out, what a innovative partnership to be not just like institution, but citywide offering these things. And I think that this is an area where this council can lead and really innovate the way that we educate our women and our families, and then also deliver, build on national data, but really develop something that's local here that works in Louisville.
Can the Ready for K Alliance sort of accelerate that or serve as a catalyst? This is a very successful organization, and I'm just, and I think I speak for the board in saying that tangible action would be good, and then clearly the board can come behind with regard to support.
Yes, I think the Ready for K Alliance, we were a partner in that report very specifically, but also just as Dr. Miller said, we have also recognized that there is no singular point in time. This is a continuum, and starting prenatally, that's when it starts, and that's when we need as a community to start making sure resources are available, and that birthing parents and families know of those resources. So I saw Leanne French on this call. I think she had to hop off, but I will just give her a shout out. She is on the Ready for K leadership team and has been an amazing leader in bringing the health aspect to Ready for K's work. We actually just in 2020 added healthy development as an outcome area that we're focused on, mostly focused on ending disparities of maternal health and prenatal and infant health, as well as access to health care for families and children. But she, I think, could be a great connector between the work that you're doing here and the work of Ready for K. And I know she is really a champion of Ready for K. So I would love to explore how we could continue that partnership, specifically related to the Center for Health Equity report, but as well in our work of Ready for K as a whole. So
thank you.
Thank you, Dr. Miller.
Dr. Eckel, hold on, I'm going to bring the phone to you.
I just want to say thank you to all of you as somebody who this has touched personally. I think that all of the work that you all are doing is really amazing. I know that we touched early on about the workforce and how the workforce has been impacted, essentially because parents are having to, realize that the cost of childcare is not worth the wages that they would make at, whatever job they would be able to have. So my question is, do we have any data or do you all have any ideas about how we can kind of, well, I mean, obviously there's a shortage in the spaces and the capacity for children, but how can we kind of bring resources or bridge a gap or encouragement to these parents, especially women, maybe single mothers or women who have had to make the choice to stay home with their children? How can we kind of either get resources to them or maybe information to them about childcare to allow them to either re-enter the workforce or, potentially go to school or, free up those hours and that time that they otherwise are spending caring for the children?
It's a great question, and I have to hop off for a 9 o'clock, but I want to pivot to Mandy because part of our policy work is around the ability for the access to CCAP, which is the Child Care Assistance Program, to expand its eligibility criteria, meaning more women would qualify. And part of that advocacy is also on the reimbursement to provider side, which hopefully would incentivize more providers to participate in CCAP, which also improves access and quality across the community. So I again, thank you so much for the invitation to be here. I apologize that I have a meeting that I now have to hop to, but I think Mandy can address that question, and we welcome any follow-up.
Thank you so much for all of your time. We have about 1 or 2 minutes left. That's it.
I'll go really quickly then and just highlight again 2 pieces of state policy and then a local programming piece that I think are really critical here. As Adria mentioned, the Child Care Assistance Program, which is the existing vehicle to provide support for qualifying parents who are working or in school full-time to receive child care, has seen 2 major improvements as a result of federal dollars directed specifically toward childcare through ARPA. It increased eligibility to 200% of the federal poverty level from 160%. We need to sustain that change, and increase provider reimbursement rates from 50% of market rate to 80% of market rate. We need to sustain that change. It is one of the most powerful vehicles that we have for allowing and empowering parents to pursue their careers in education. So right now, we're working closely with Kentucky Youth Advocates and others in the Ready for K Alliance to make sure that there is a broad awareness campaign about that eligibility increase and make sure that parents are equipped to navigate the application process for CCAP. And we're working hard through the state budget process that's happening in the legislative session now to ensure that we've got the investments needed to sustain those changes in the long term. The other thing I would note is if you have a chance to take a look at House Bill 499, it would establish the Employer Child Care Assistance Partnership that would essentially match benefits that employers pay for childcare with state dollars. So it would be the first time that at scale we're bringing in private sector resources into the childcare industry that those private sector employers depend upon. We need resources coming from every place that is truly a part of this ecosystem, whether it's had skin in the game before or not. And then finally, I would say our incredible partners here at Community Coordinated Childcare 4C are the place to go for parents who need help with any component of childcare. CCAP, finding a provider, finding an educator who can serve special needs. They are it. Community Coordinated Childcare 4C will make sure you have the link to their services.
Thank you very much. And thank you to Metro United Way, to the council people. And we will be back in touch, and if you'll get materials to Dr. Moyer, to Amanda, that would be great. Any final comments from the board? Do you want to do it for both? Yeah, let's do that. I think, hearing from the board members, we have a quorum, and so therefore, do we have consensus and someone to move that the board support, and we'll get specifics on supporting childcare reimbursement and incentives, I guess. And in the incentives piece, I would include both financial and human, and corporate as well, resources to spur these efforts, and to the House Bill 429. 429, is that correct?
499.
499. Whose bill is that, please?
It's Representative Samara Hebron.
Okay. Is there a bipartisan support for it?
Yes. In fact, there are 51 co-sponsors from the House.
All right. So may I have a motion from the board to support and this particular piece of legislation and what we've spoken about today?
I have to jump in
Ms.
here.
Handmaker?
I am totally in support of this, but I might have a conflict. So do you have a quorum without me?
I don't know. I'll put the people in charge. I do words, not people.
Ed can turn on his camera.
Ed, Dr. Miller, can you turn on your camera? Then we will.
Yes.
Thank you.
That would be great. I mean, I do totally support
Just for a second. Thank you so much. Okay. Do I hear a motion then?
I move.
It has been moved by Dr. Eccles. Is there a second?
Second.
Thank you, Dr. Miller. Is there a discussion? Hearing none. All in favor, raise your hand. Both hands. Some of us believe in voting early and often. All opposed? Abstentions? Motion carries. And we will send a letter, and I would ask the department's help in doing that. And actually, I will turn to our partners at Metro United Way for help on that. And I think we go from here. Thank you very much. And hopefully we change the system positively.
We can together. Thank you all very much for your time.
Yes. Okay.
Thank you.
Thank you. This was enlightening and insightful. So just moving on very quickly, in your packet, and this would be part of the chair's update, you got some attachments, the effectiveness of government mandates on masking, which were positive, but more importantly, there was a study done in May of 2021 by the Big Cities Health Coalition, an impressive group of big cities, of which Dr. Moyer now joins, representing Louisville Metro on the prevention of violence. And we will be looking next month to that particular topic, given current events and the rise of this tragic occurrence, which clearly stems from, as people in my line, in my vocation would say, the social determinants of health. Next, we move to Dr. Moyer, director's comments, top couple activities and initiatives for the next 30 to 45 days, and a couple of the key after actions from COVID that the department will be operationalizing. They have a list of, I think, 70 plus. It's not without insights. Dr. Moyer.
Thank you, Chair Heidi. So as Heidi mentioned, well, one, please just make sure you take the time to read the report in your board packet. I don't go over it now just for the sake of time, so we can have that great discussions that we have like on childcare and other issues, but it has a lot of great information and a great way to stay up to date on what my team is doing, because they, as always, are amazing. So goals for the next month, number one is hopefully the health ARP funding will be moving forward. So really trying to advocate the top things that hopefully will go through is our electronic health record, funding for a new building, expanding our lead program, and then continuing some of the great COVID work that we are doing. So really appreciate you guys' support and advocacy for those things as that hopefully moves through council this month. As Heidi mentioned, we've had a list of over 70 action items that came out of our after action report on COVID. So we are analyzing that now, trying to see a lot of the pieces overlap with our strategic plan for the next month. And so this month, we're going to be diving into that, seeing what overlaps, what needs to be a priority, and I will have that for you all next month when we come back. So I'm really diving into that this month. And then other priority, just continuing to transition staff back to pre-COVID work and post-COVID needs. A lot of things, as we keep saying, COVID has really highlighted a lot of the inequities, a lot of some disparities that we have in our community. And so there are new needs that we will be transitioning to and trying to build up, as well as going back to pre-COVID activities. So, and maintaining that infrastructure that we needed to respond if another variant pops up again. But I think you've probably all seen in the news, COVID numbers do continue to trend down, which is a huge relief. We're down to 27 cases per day per 100,000 right now, which is huge decrease from I think we were like in the 300s last month. Hospitalizations down to 163. So really going in the right direction there. Hopeful. If you guys haven't seen it, the CDC did release new kind of guidelines, way they're measuring community burden now from community transition. The last data that they're following, they developed that pre-vaccine, pre-treatments that we have now. And so they analyzed all the data from the last 2 years and came up with these new metrics that are based a lot on hospitalizations as well as case counts in communities. And then we'll be relying on surveillance data with wastewater and other things to make sure that we have confidence in what we're doing. But that is all trending down. So that's all good news there. So I will stop and pass it back to Heidi.
Very good. Any questions for Dr. Moyer? Any questions for Dr. Moyer? Sorry. Okay. Pardon?
They know where to find me.
Yes, yes. We're all findable, trust me. Angela Hayes from JCPS, one of our heroes. There she is.
Hello. What we're working on, and I'm very excited about, is we are rolling out COVID vaccine clinics to all schools. So that is starting tomorrow. We are taking COVID vaccines into the schools. So that will be available to all of our students, and our staff members will be able to partake in that as well. So they can start their series, get their second vaccine or their booster if they need to. So that's what we're busy working on, and we're very excited about that.
Okay. Questions for Angela? Okay. Excellent. Thank you for all your work. We just need now a magic potion for the mental health issues which plague young students, and sort of fits with our child care focus this morning. Dr. Val is unavailable this morning, but says that they're working on their strategic plan for a Greater Louisville Medical Society. Ms. Manson for the Kentucky Nurses Association. Good morning.
Good morning. Thank you. This is my first meeting. This is a very exciting board. I'm just delighted to join. I represent 89,000 nurses in the state of Kentucky, and there are approximately 16,000 in Jefferson County. And we've been busy doing vaccines and testing in collaboration with the health department, and we've provided about 16,000 tests and vaccines. One of the notable things in the last 2 weeks, we have not had a positive. That has not happened since the beginning of the COVID pandemic. Also, we're working with the State Department of Health, and they are working on changing our language about vaccinations and calling it, are you up to date? And with your series, including your first 2 and then your booster, and if you are immunocompromised, that you get a 3rd dose. So that's language that we're beginning to share with all of our nurses. And the other main thing is we're going to start looking at how can we provide vaccination clinics for the football or the soccer clubs. And so I have been engaging in some conversations with the health department to see how could we possibly do something like that. That would be very creative and innovative, but this health department is up for that type of thing. So I'm delighted to be with this group and to be in collaboration with the health department.
Thank you very, very much. And to all of your tens of thousands of nurses, thank you. I neglected something under Dr. Moyer's report that I want to share, and Amanda corrects me if I don't say this correctly. The department is launching a blood drive for the blood shortages. They have 30+ slots open. It's open to the public, and I would ask Amanda when we send decks out and my little post-meeting note that we include the flyer that you sent me. And there is an employee who at the department who has a young daughter who gets daily transfusions. So in recognition and tribute to the indefatigable efforts of the department, anyone who can help get that message out to their networks would be appreciated. So very, very briefly, Dr. Eccles, then Dr. Irwin or Ms. Shoemaker, and Dr. Zippel. Just a minute or two. Oh, sorry.
The immunization committee met this past month on the 11th, at which time we were able to have a discussion with JCPS language services. So we are still continuing to focus on the ways that we can really reach communities that are not English speaking as their first language. And that will be that's kind of our main focus and our priority right now, along with expanding education and just advocacy for using the state immunization health record. Our next meeting will be on March 11th at noon.
So with regard to Behavioral Health Committee, the work around the Adverse Childhood Experiences Project continues, series of conversations happening, looking for partners. It's in that kind of stage, so a lot of discussion. The Police Deflection Project actually starts on March 21st. First, a mobile team on the ground at that point. 7 counties will have a team out for 1 shift a day, and the School of Public Health will be doing the evaluation of that. Report due to council sometime by the end of April.
Okay, and Dr. Irwin or Ashley Shoemaker, Ms. Shoemaker.
So go ahead, Ashley.
Sure. The coalition met on February 14th. We discussed the high numbers of Medicaid members in the state and in Jefferson County. We're still seeing record high number of people enrolled in Medicaid. Additionally, during open enrollment in the state, over 74,000 people enrolled in qualified health plans on Connect, and the overwhelming majority of them were eligible for enhanced tax subsidies thanks to ARPA. The coalition is anticipating, looking forward to the end of the Medicaid continuous coverage that has been happening due to the HHS public health emergency. And when that ends, the state is anticipating that over 80,000 Kentuckians will fall off of Medicaid. Many of them will need to enroll in qualified health plans or insurance through employers. And an additional 200,000 will need to recertify their Medicaid benefits. So we are working with the state and with the managed care organizations to develop a message for those individuals. And our next yes.
I'm sorry.
I was just going to say our next meeting is scheduled for April 11th at 4 o'clock.
Very good. Karen Haskell, the CEO, president of the Healing Place, who's joining our board, would also like to be a part of the outreach and coverage coalition. So, and I think she was going to contact you directly. I don't know if that's occurred or not.
I'll reach out to her.
Okay, very good. Dr. Irwin, anything to add?
I have nothing to add. Thanks.
Okay. Let's see. All right. New business. Anyone have new business? And then what I would like to do is to spend a couple minutes on any insights from today or since our last meeting. And so I throw it open to the board. Okay. One point I might add, which was interesting, and it was one of the TV docs, likely on CNN, with regard to COVID, and that was, and we talked about, and I think Dr. Moyer did in her report, about declining cases, et cetera, et cetera. And in terms of takeaway, and it might have been also with vaccines, the antivirals that are being developed and are adding to the fact that perhaps going forward as we look at wobblers, is what I call them, in the environment coming next, not as a variant, but just as a wobbler, that if someone has a positive test, then they're given an antiviral. That's not available today, but clearly that's what researchers are out there doing. It was an interesting report, and in the line of after actions and insights from what we've been through over now beginning the third year. So, as I mentioned, our next meeting is March 30th. You'll get updates from me. Any final comments? And this was our inaugural dip into the deep end of the University of Louisville Clinical Translational Research Building. So I think we'll all end up in the right place the next time, especially as a chair. I am like a dead bloodhound, so it follows in my ability. So please stay safe, be well, continue doing the remarkable community change that you are affecting, and see you next month. Is there a motion to adjourn? So much for Robert. Thank you. Ms. Handmaker, is there a second? Thank you, Dr. Eccles. All in favor? Opposed? Motion carries. Adjourned with a smile. Thank you.